to the next episode, What About My Practice, where we discuss various aspects that affect us in private dental clinics. In this episode 4, in our series where we look specifically at the impact coronavirus has had on our practices, we have an interview with 2 Cape Town specialists to discuss how they have prepared to see dental emergencies during this time. Remember to like our Facebook page and our Instagram page to receive up-to-date information on this series and the other programs brought to you by the Bridge Program and the Implant and Aesthetic Academy.
Welcome everyone. This is the 4th episode of our podcast video series for Bridge Program. And today we've got 2 friends here with us, Emil and Corlene. Welcome, guys.
Thanks.
Hello.
Hello. And we have the privilege of working with these guys quite closely. So today we just wanted to run through what they are doing in their own practices and how they are managing this lockdown. So just to give us some feedback on how your first week was, tell us a little bit about week 1, Emil. How did you experience it? What were you up to?
Yeah, thanks for the invitation. I think this first week was quite a new week for us all. I think we're in a good position that we had about 5 days to prepare. But bottom line at this stage is you have to take it week by week. And so this week we mostly dealt with a few patients who went to the dentist already, had antibiotics for infections. The antibiotics didn't work, then they would contact us. So major changes. I think Corlene can also speak more about that. But yeah, like I said, first week went quite well, but still it's a week-on-week basis. So tomorrow is Friday, and we have to start to plan for next week. That we don't know exactly what will happen yet.
Yes. So I'm just going to interrupt myself and you guys there. I just want to give some context. I didn't actually say this in the beginning, but Emil and Corlene are both 2 periodontists, and they are in practice in Claremont and Newlands. So that's why we wanted to get your input, to get the input for 2 periodontists from 2 specialists, I think would be very helpful, especially in this time now. So Corlene, just tell us what your first week was like.
I'm not going to lie, it was a bit scary. I think for all of us, dentistry, as we know, this changed completely. From where you went to do any case, now you're forced to only do limited cases, only emergencies. And I'm still trying to wrap my head around all of this new information and new experiences that we have to go through. But it is actually nice to have a partner in crime that we can sit and discuss all of this stuff and try to figure out what we're going to do and how we're going to manage. So it was an interesting week. We tried to not be too lazy and actually set up some protocols that we can follow. And so feedback from this is that we survived the first week so far, but now we have to build on this. And that's the interesting part.
Yes, I suppose the question is, do you have enough wine for week 2 and for week 3?
I've already been banned from drinking wine. My wife's put a curfew on me.
We started with
some Coke Light only.
I'm keeping my water close.
Well done, guys.
So, Corlene, you were talking about just doing some research and trying to find out about what's out there at the moment. Where exactly did you go look for the information, and what kind of stuff did you come across as you were doing that?
John, I think this is the biggest problem we're struggling with at the moment, because we are almost flooded with information, but how do you know if it's correct, if it's not fake news? So that was the biggest problem for me, to first just establish what is guidelines that we can use. And I don't know about you, luckily SADA did bring out guidelines, but still it's giving us some guidance, but it's not really telling us how we have to prepare to see our patients. So we actually have to follow what the other countries are doing and see what they're preparing there. Because if we just start off and thinking about the current PPE situation, so personal protective gear that we have and do not have. So most of the videos, there's a lot of videos that was released telling us how to put on, how to take off the personal protective equipment. But if you look at most of them, it's more for medical doctors who needs to do swabs from patients. It is not for dentists seeing patients. So that is where we're struggling, and Emil can give his input from this. What do we use and can we use it? And is it sufficient for us to see patients with the current guidelines that we actually don't have?
So you're almost working, trying to filter through all the information that's worldwide and then deciding what you can implement in the South African circumstances and what is available to us. Yeah?
Yes, so we're using the World Health Organization, the CDC, the Center of Disease Control. There's numerous articles and documents there, but still for dentists specifically, we're struggling to get enough guidance for us to actually see patients during this emergency crisis time.
And have you looked at the American Dental Association or the British Dental Association? Have you come anything across in those two big areas?
The nice part of that is they're giving us this, they're demonstrating what you need and what you can use. But for us being a third world country, the problem is that we don't have access to most of the protective gear that you need. And if we have limited stock. And if you really go look into it, if you are 3 people seeing a patient, each of those persons need to be dressed in a full gear, and you actually have to take it off, throw it out, and use new gear for each and every patient. And we are unfortunately not in a position to do that.
Okay, yeah. So in other words, we can look at what are the alternatives and what we can implement in our daily practices that we can actually try and at least help a few people.
Yes.
In the meantime, Emil, what have you got that you've come across or that you've thought of in this time?
I think, like Corlene said, we looked at all the protocols that's available, the PPE. I think we are quite lucky that Wasara did send some good information. There is quite good protocols from the Department of Health as well, because we are still working under them. Okay. So then you can also use what's available or from overseas. But yeah, the major thing is, like Corlene said, you can use a PPE, but how to use it, how to gown, how to remove the gowns. That's mainly for facilities where you work in a single room. It's for medical doctors. You take a swab and you discard of all that PPE in the same room itself. So one thing is about that, but the second thing in what dental is, we work in one room. We work with a lot of dental equipment, and then that needs to be sterilized. And most of us, that has to be sterilized in the sterilization rooms. So there's no protocols for that, because what do you do are done? You can maybe discard your gown and all that, but what about the rest of the information? So, and again, I think that's our biggest problem, because in each patient that you also treat, it's you, your assistant, and it's actually the person who needs to sterilize. So you are talking already about each mask times 3. And again, that's why I say we can plan ahead, but I think our limit is about a week. But
say that again, your limit is a week of?
We can plan, but that's only on a weekly basis. Also, if you look at bigger hospitals, because we also work at Mediclinic, they also, even they don't have all the PPE that you would need long-term wise, especially in dental. As we discussed before, you get exposed to aerosols. And that's our biggest problem at the moment. So yeah, it's, I think you need to do what you can, do as best as you can, but PPE we will never be able to solve it and to get it 100%.
Corlene, you saw a few patients on a couple of days ago, and obviously I'm preparing to see fewer patients tomorrow. What was your experience then, specifically regarding the PPEs and going through the whole process that you've created?
Sorry, you did break up a little bit there, but what I heard you saying is what was my experience like with the patients that I saw and the PPE and the process.
Now, can I just stop you quickly? Just hold on.
Yeah.
Okay, let me just say the question again. So, Emil, you've spoken about all the requirements. Corlene, what was your experience with the patients that you saw a couple of days ago, specifically regarding the PPEs and what you had to go through in the process that you followed?
So yes, my experience was that I didn't feel like I knew enough. I think that's the baseline. So I did what I could. I followed and looked at a million videos and followed the guidelines that I had to my disposal. But I think that's really what it boils down to. We can do what we can, and we have an ethical and obligation, and probably a moral obligation to our patients and to ourselves and our staff. I used what I had. I had a relatively good mask times 3. So I had 3 masks. I had goggles. I had a visor thing, and I had a gown and a cap, and that's what I had. Whether that was enough how do we know? And my nurse had exactly the same PPE. So that was the PPE we have in our practice. And I think the way that we're approaching it is really, like Emil and Corlene has also said, we're just trying to do what we can. We're not trying to do elective procedures. We're really helping people with pain and real emergencies. And basically we are putting ourselves at risk because we don't know. But that brings up a question about how are we supposed to make decisions on this. I think it actually just brought out a lot of loopholes and a lot of lacking in our training and the way that we are set up as dentists. So, this whole thing has really shone on all the holes in the system, and now we can maybe do things differently. So if we look at our practices, maybe Emil and Corlene can also comment on that. What was their processes like, the process of going through this? Did you actually do a dummy run? How did you decide did you unpack your whole practice? Did you do a spring clean? What did you guys do?
So I can start answering because Emil enjoyed cleaning the deurkusyne, the entry door frames. Thank you. So we were quite busy just starting off with the spring clean, and it's actually interesting. You think your practice is clean until you do a spring clean and you realize actually, it's not what you thought. And well, the layout, and I'm going to show you a photo of our practice. So there's we have few entryways into our practice, which actually helps us.
Screen with us if you want.
Okay, yes. Let me show you what's going on here. Okay, so I just quickly want to. Sorry. Okay, sorry, I just want to start here. So we have a few entryways into our practice. So our practice is the first floor or ground floor. It's actually not really the ground floor because it's not on the street, but our practice is located in this area here. Can you see my mouse? Or is it not visible? No, you can't see it.
No.
Okay.
I think you're on a different screen at the moment.
Okay, wait. Okay, but anyway, so our practice.
We can only see the dental chair.
Yeah, so I am. Sorry. Okay, just tell me, I'm going to flip through the images if you can see the...
Okay. Oh, there
Can
we
you
go,
see
yeah.
the main building
Yeah.
now?
Yeah.
Okay, so our practice is the ground floor of this big complex, Letter State House. And here you can see our oral hygienist, Emma, standing outside, and we place a table and a chair outside. The idea would be, and we're going to let Emma actually discuss her role with you just now, but she's acts as our chaperone to actually receive the patients and give them guidance. And can you see here that you see two doors? The right-hand side is our entrance to our practice, where the left-hand side you can see our dental chair.
Yeah.
And if we move a bit closer, this is the nice part of our layout of our practice, is that the patient can actually access the dental chair from outside, from outside and move inwards. An idea for us with this is also to minimize the patient's entry into the practice. We only want to give them access to this one room and minimize any contamination to other areas. If you also have a look, I'm moving closer in, we've actually removed everything from this room, everything that's not necessary. The idea was actually also to remove the computer, but we decided for dental x-rays, we're rather going to leave that now. But you can see everything was cleared out. And the reason for this is also for the disinfection protocol that needs to start before and afterwards. We know a lot of our furniture and a lot of our cupboards and everything might even get damaged through this process, but the idea is to almost spray this whole place with hydrogen peroxide, bleach solution, chlorine solution, just to disinfect it. And that is why, having this one room allows us to do that. Only have one entryway. The only problem is, and that's what we mentioned, we have to take the instruments to the sterilization site. And that's still an area that we want to try and figure out how we can minimize this and actually try to do most of the contamination in this site alone.
In other words, that you don't have to leave the room whatsoever.
Yes.
Okay.
Emil, any feedback for your side?
Yeah, this room, as we said, it was a thinking process of what to do, where to work and all that. We decided on this room for our main room to treat because it's the smallest one, so it's easiest to decontaminate afterwards. And also because for now, this is the easiest exit to the outside. But it's like what Corlene said, unfortunately, you are quite hard on your room. If you look on this photo, you'll see in one of the cupboards, there's a little green canister there. So in that...
That's not whiskey.
That's not whiskey. So that's where we mixed our bleach, and then afterwards, actually, the whole room is bleached out. And that's another point, as we said, you can't treat a lot of patients after one another. You almost leave a good 1 to 2 hours afterwards to be able to clean this your room again.
So you allowing yourself to treat a single patient, then completely disinfect the room using your alcohol spray that you've got in your cupboard, and all sterile instruments, everything out, and then you start again. So it's almost about an hour between patients.
At least.
At least, yeah. And again, you have to look at the type of work you do. We are quite lucky because we don't get a lot of emergencies per day. We should be able to, let's say, if you will treat a patient at 10 and 2 and at 12 o'clock. If we get 3 patients a day, that would be actually quite a bit. So that allows us to spend a lot of time in between the work. I think it's harder for you having to work with your type of work because there might actually be more type of emergencies. Our work is mostly the tooth is not responding on antibiotics and the tooth needs to come out. That's when we get involved. But yeah, it's like we said, you have to do the best what you can. And at this stage, this should be sufficient.
And I know we can still be criticized on this. Emil said he's going to bring his toolbox and he actually wants to remove more stuff from this room. But I said, let's just wait before we damage all our equipment and just see what we can do.
Yes.
Just as a question, the first thing that comes to mind is here we are going through all these rigmaroles and trying our utmost to create a nice, clean, sterile environment and try and minimize contamination. Yet you can go down to the local shop and be in contact with 50 different people as you stand in line. So what is the reason that as dentists specifically, we are so precise and so focused on trying to work in this clean and, at least in this clean environment where we can't cause any cross-contamination specifically for COVID? Corlene, if you could maybe think about that.
Yeah, I mean, obviously we work with saliva. That's literally our job. We just work with saliva all day long. I think that's one of the first reasons that we are being hypervigilant about the way that we're doing our treatments. But I also think that we want to make ourselves, our staff and our patients feel safe. So we are trying to do all of this in protecting ourselves, protecting our patients in the saliva-rich environment. If we can prevent air spray, so I mean that's also part of the guidelines that we saw, is to minimize any sort of aerosol spray and to not use your 3-in-1 syringe, to obviously always work with rubber dam. So those are things that we do in any case. But I think what you also, maybe the point that you're trying to make, Jean, is that, how are we gonna do things differently when this is all over? Are we still gonna work with N95 mask and a gown? Is that what dentistry is gonna be like? Who knows?
We don't know.
We have no idea. And it's a valid point that you're making, that we're probably putting ourselves more at risk in going to Woolies and buying fresh fruit and vegetables at this stage than to working in our own practices. I think it's probably one of the safest places that you can be is in a dental practice that has been cleaned and that where we are following these protocols. We really are just trying our best, I suppose.
Yeah. The whole idea, correct if I'm wrong, Corlene, is that because we work with saliva, obviously the virus is contained within saliva and droplets, and by using sprays and turbines, which produces high air pressure, you get a lot of spray going all over the place, which means that it can literally end up on your clothes, in your face, in your eyes, in your nose, in your ears, in your hair, everywhere. And then once you leave that environment, you're literally carrying those things for the next 2-3 days unless you don't go wash your hair. Understand? So that is really the crux of the matter is we need to limit that exposure because of the process we follow and the things that we do with all the spray that we create. Yeah?
Yes. Yeah, John, another thing that I wanted to mention is that we also decided on to almost appoint a core team to do the work. Because yes, we rearranged our practice, but the next part is actually who are you going to allow to work and who needs to work, and how can you almost specify the roles that each person needs to have. And me and Emil and I, we decided that we actually going to assist each other. And I think in a lot of practice they would actually say that's not the best idea, because what if one of us gets infected, then the other one's also out. But we almost decided that that's the best way that we can limit any contamination, in the sense that with all our training from our oral medicine, with our periodontic side, it actually enables us to be very critical on our surroundings. Because, as I said, we saw our first patient, and it was quite a daunting task, actually from start to finish. After this patient, you were so exhausted because it's just all this new awareness that you have to have while you're working. I was so everywhere my hands touched, I realized, okay, I must just make sure afterwards that we spray that we clean that. And even I only was allowed to stay in the one room. Emil came in and he set up while I was busy working with the patient, and then he also did the sterilization afterwards. So it's quite a new avenue that we're following, but we try to see how we can minimize the risk of any contamination or infection or all those avenues.
Corlene, can you just close your share screen there first, please? Unless there's something. Thank you. Emil, just a question that I had was, what happens if you get sick? Doesn't that effectively mean that both you, Corlene, and Emma are not allowed to work for 2 weeks?
Yeah, what we realize, and that comes from especially your medical side, your team is only as good as your weakest link. That's what we decided is with our type of work, if we have to remove an abscess or a tooth, many times we don't have to use a drill now to generate aerosols. So you can sometimes work carefully and still with minimal trauma. Your contact time that you get the patient in the practice and outside again must be as quick as possible, but not meaning you have to rush, but you need to work as effective as possible. And that's the advantage of me and Corlene. We know our work, we know also how to work with each other. So as I will assist her, I can predict what she's going to do next. So we get that process right. But the second thing is what's also tiresome, you have to really concentrate what you do the whole time. Try and contaminate as less as possible of workspaces. So yes, it is. If one of us will get sick, then we will have to stop the whole team. And yeah, we will have to take a break for 2 weeks or to a month even. But still, I think at this stage, it's safe for us to work as a core team between me and Corlene, because you also have to take care of what goes on after you are done with the procedure. And sterilization is a daunting task as well. And got Emma, who then almost replaces our work as communicating with the patient. That's why she's the third part of the team at this stage. And again, I think we have to focus on that. What will happen after this 2 weeks? We don't know yet what's going to happen. But at this stage, we said, well, for this week, we do assist for each other. It makes we try and keep it as safe as simple. If we then have to divide our teams next week, then we know exactly as well what we have established, and we can then take this way of treatment and start to bring in our assistants. If we had to work already with aerosols or that, I think that might have been different then. But at the stage, would you
then split up the team like we've done?
Yes, yeah. If we had to work higher risk like that, then we would have done immediately. At this stage, we are quite well prepared also with our wear as well. Nothing will be ever enough for dentistry, but it's also the decision that you made. You don't have to work at this stage. You don't have to do dental emergencies, but we felt that at this stage we want to deal with it.
Yeah, that's a good point that you're making, Emil. I think it's important to note that this is still a choice. that we are not going to be driven by greed or fear. And this you are treating patients because you are providing I think that we become very easily entangled in this loophole of being scared of, where what would be driving a lot of people, which we can't really comment on that now, but that is in the back of all our minds. So I think if we just keep a focus on serving people and helping people, we'll be able to make decisions a lot better. And it's interesting that you guys are doing it differently than what we are doing it. We decided to divide up in 2 teams, and Jean and I are not allowed to see each other in this 3 weeks because we wanted to at least have one person working if the other one would be sick. But it just shows you again that everyone will have a different opinion. So you guys are doing it your way, we're doing it our way, and so will a lot of other people have opinions of their own. So when we are talking about this, we're not trying to set out rules or regulations or protocols. We're really just figuring out how we can help each other and maybe just brainstorming around it. So we probably will receive a bit of critique on how each one of us are doing it, which is fine because maybe we learn from that. But we can also just improve. I think dentistry will never be the same again. That we all know. We have no idea what's waiting for us at the end of the next 2 weeks, but we know that it won't be the same. Jean, is there anything that you're thinking of now that you're seeing your patients tomorrow? Anything that comes to mind that you would probably do differently after having this conversation?
Differently to what we've agreed upon as the protocol? No, I think we've kind of ticked all the boxes as far as we can. We're in a slightly different position in the sense that we have 7 surgeries we can work with. So I'm definitely looking at using hot chairs. So I'm going to identify the patients that are going to probably need the most intensive treatment, for instance, emergency root treatments like that I will put into a specific room that is built, so my surgery or your surgery, for instance. And then the smaller things that are more of the fractured tooth that you need to just try and cover and to limit the pain for the patient, that I can do in a room that has got less equipment in. And then minimize where I didn't need to carry anything around as much. And then try and limit, take the patient directly to that designated room and treat them in that room specifically and go out. And then when I'm done, we can basically go back and treat and clean each and every single room as a final cleanup. So that's kind of how I'm looking at setting it up for tomorrow. I don't know if you guys agree with me, specialists.
Yeah.
But that's kind of how obviously I'm not going to use any aerosol spray, and I'm not going to use any hand pieces where possible. And if I do use any hand pieces, it will all be done under rubber dam. That's really the limitations that I have at the moment.
I think we're just realizing how much work it's going to be now moving forward, because it really changes everything. We are aware of normal sterilization and disinfection protocols, but this is really just taking it to that next level. A lot of work and a lot of cooperation and it's basically teamwork that you need. Everyone must be on the same page and know what's going on.
Yeah.
What I think we can do is, Emil, what we can do is maybe just wrap it up here, and then we can have a next session. I think, if possible, with the 4 of us, maybe just have a look at some practical tips as to how PPE works, what is PPE, and how we can use it in our practice specifically. If you guys are happy with that, I think we can do that.
Yeah, so can I just quickly add something to that in closing?
Yes, please. You can close up first if you like.
Okay. Emil, do you still want to add something there?
Yeah, just quickly, I think as I listened to what is Jean now, and that's the main message, I mean, you have to think about your way of the layout of your work, your practice, your staff, what you do. And that will, if you really think about all those things, then you will later start to realize what to do. And it's like, it's for example, it's what Jean said, you've got 7 chairs, use your 7 chairs. In our, for instance, at this stage, we limit the rest of our practice because we've got one room or directly outside. If we would want to use more chairs, then we have to rethink the whole process again. And it might come, but it depends on what's waiting for us next week and what's the demand next week.
Okay.
So just in closing, I wanted to ask you guys if there are dentists that feel that they have a situation or a patient that they're not sure how to manage. Are you guys open for them to get in contact with you or maybe refer patients? And what would the channels be that they can follow?
Well, basically, we're giving our cell phone numbers because I think that's the easiest way to get hold of us. I think I'm more reachable than Emil. But yeah, so
You'll include your numbers in the notes then or in the comments afterwards.
Yeah, so that you can get the cell
Put
phone
your contact
numbers.
details in there.
Okay, perfect.
Okay. Thanks, guys. We'll chat again, and we'll try and break this down a little bit further with practical tips.
Okay, thank you.
Bye.
Bye.
Thank you.
Thanks.